Vinnie Kennitzer has been sober for a year and a half. However, it wasn't an easy task to get here.
Started drinking when I was probably 15, 16. Then just casual drinking, but in the last probably 4 or 5 years, it really got bad.
He will admit there's been many ups and downs. He first started seeking treatment with Vera several years ago.
I first met Vinnie about 15 years ago when he first came into treatment. He was struggling with alcohol use. He had had some trouble related to his job, and so he came into treatment for the first time then, and I was his counselor. And he, through the years, had come back through our program a few different times.
But it was different the last time he went through the program. He participated in a 4-week outpatient program, which involved group work and individual sessions.
So the group sessions focus on some education. We talk about the 12 steps. We talk about different emotions. We talk about different coping skills. So they're led by counselors. And then they also have individual sessions with their primary counselor at least once a week.
I liked it. It kept me busy all day. They teach you what drinking does to you, and if you want to drink, how to work so you don't have to have a drink. They just teach you, they call it tools. They call it your toolbox. It'd be like calling a counselor or talking to people there at the hospital.
Plus, it was recommended that he try a sober living home, which Vinnie says has played a big role in his success in maintaining sobriety.
And they said, well, let's go to Redfield, it's a reflection center. And that was the key, because I think the key before was I get out of the hospital and then I could drink. But here at Reflections, you can't drink, and I think that's what saved me.
We can give them tools in treatment, but when they get out of treatment, that's where they really need to make sure they can implement those tools. So he got down to Redfield, has turned things around.
Hepperly says they will look at a person's needs to help determine what level of care will be most beneficial to a patient.
We want to make sure that we are meeting their needs. So some individuals can be very successful in a lower level of care. They may only need to come to groups in the evenings, 3 nights a week. Some individuals need to go to an inpatient program for 30 days. Some people need a longer term program than that.
And in Vinnie's case, he found the proper tools to lead him to a path of success.
One day at a time, that's the way to do it. And that's what I've been doing. And that's what they teach you at Vera. One day at a time.